All right. Hi, everyone. I'm really excited to be here with Dr. Debby Hamilton. Dr. Debby Hamilton is a medical doctor and has her master's in public health. She's an integrative pediatrician that works with children with chronic illnesses. She also works for Research Nutritionals, and she has a book called Preventing Autism and ADHD, Controlling Risk Factors Before, During, and After Pregnancy. Dr. Hamilton, I met her early in my practice and I've been following her work ever since. She's going to be talking to us about Th helper cell regulation and how that impacts autoimmunity. And this is so important for pretty much all of our practices. I would say over 90% of my practice is autoimmune disease with autism, PANS, PANDAS, and other infections. So her work is important and she has a lot of knowledge to share with us. So I'm excited for her to share it with the CNPA community. So thank you for being here with us, Dr. Hamilton.
Yeah, well, thank you for the invitation. And yes, hopefully this will be informative.
Yes.
I do agree that so many of our chronic patients have some kind of autoimmune issue. And I treat some of the same kind of patients that you do with autism and PANS, PANDAS, and, like autism most people don't think of that as having an autoimmune disease. So.
Absolutely. Absolutely. So I guess we'll get right into it. Dr. Hamilton wrote 2 amazing articles for the Th17 letter about Th cell regulation, and I encourage all of you to look into it. So we'll send out those resources at the end of this call for you. But, to get into it, Dr. Hamilton, why do we need to discuss the issue of the Th helper 17 cells and autoimmunity?
Like we said, autoimmunity is so prevalent, but I think just if you think about integrative medicine is trying to understand what is happening in the body so we can actually basically go towards the target. So the idea of T helper cells, we're talking about obviously lymphocytes. And I'm going to talk about the balance because there's more than one type of T helper cell. But we've really learned in the last couple of years that this T helper 17 cell, when it's elevated, really drives the inflammation for the autoimmune disease. And it was really thought that it was more of a Th1, so a different one of the helper cells, drove autoimmunity. So a lot of people still think that. And so then in terms of treatment, you're not always targeting what you think you're doing. And when I also think about the T helper cells, if they're imbalanced, you got to think about inflammation. And inflammation goes with autoimmune disease. So I think I said, again, if you understand what is going on, then you can actually target the mechanisms in order to treat the disease.
Yeah,
right?
And
going towards the cause.
Right. It's been a while since some of us have been in immunology class. So do you mind describing the difference between Th1 and Th2 and Th17 and the Treg cells and why they are important?
Sure. So, all the helper cells derive from CD4 cells, right? Think about when we learned CD4 and CD8. So the helper cells are like that. They communicate, different things in the immune system. So as I thought, until about 2003, we thought there's only 2 helper cells. So there's the Th1 cells, which are more for cell-mediated immunity. And again, you have your stem cells. Depending on what's going on in the body, is there an infection, there's something going on, different cytokines tell those stem cells to go towards a different way. So the Th1 cells are more cell-mediated immunity, think of like viruses. The Th2 are technically like the antibody-mediated, right? So think about usually more kind of bacterial infections, although our tricky infections like Lyme don't follow rules. And so then they trick the immune system towards a way that they can't be basically gotten. Mycoplasma is also another one of those.
Right.
So they found Th17 in like 2003, and it's very much like they have half of it is exactly like the Th1, which is why they couldn't tell the difference. So Th17 cells line the hollow organs. So they line the digestive tract, they line the sinuses, they line the lungs. That leaky gut.
Right.
Well, if there's inflammation or bacterial in the gut, it actually triggers a Th17 to go into more pathologic role. It tries to get the extracellular bacteria. When the Th17 goes up, it actually releases its own cytokines, which tell neutrophils and macrophages to come in. And if there are too many of them, the neutrophils release all these chemicals, which literally damage the tissues. So that's so I think about elevated Th17 good for extracellular infections, but if it's too high, then for autoimmunity. And then the Treg cells, the regulatory cells, are immune tolerance, right? And you want a balance between the Th17 and Treg cells. So you really want a balance between all those. So that's kind of T helper cell, the basics.
Yeah. So we learned a lot, going through school about the balance between Th1 and Th2 and kind of
Right.
how that is so important in regards to the immune system. But it seems like from what you're saying that it's kind of changed that paradigm, right? From the Th1 to Th2 balance to more of a Th1, Th2, Th17 and Treg balance. Is that correct?
Right. Right. And there is a really good article that Lily calls like CD4, and it has a great chart, and it has all four of those, and it has like which cytokines kind of trigger that, which cytokines it releases. And I think I talked about that in the article, but that really explains, and in my article, I explained like how things have shifted.
Right.
But it also explained in terms of treatment, you really realize that, God, if you have somebody really high inflammation, and since Th17 calls in those neutrophils, if you have somebody on a CBC, that neutrophils in the higher portion of it, it's like the high normal or even high, it's like, oh, they might really have a Th17 shift. Because people was like, well, how do you know? And so that's kind of like a little clue.
Right.
Does that make sense?
Yeah. And I loved kind of the graphs and even the table that you had in the Th17 article, the first part 1. I think that was really helpful clinically, just as like a quick guide to go back and forth, when you need to in practice. So how does these imbalances lead to autoimmune disease?
Yeah. Well, I think of like the classic one, because I think about if you have in our traditional paradigm, if the Th1 is elevated, you have autoimmune disease, right? If the Th2 is elevated and you've got quote unquote the Th2 dominant, you've got more allergies and asthma. But if you think of our chronic patients, then in theory, then if they're not, they shouldn't both be elevated, which means you shouldn't have autoimmune disease and asthma and allergies and reactions, but all our patients do. Yeah. Excuse me. Excuse me. So that's why it doesn't make sense.
Right.
So what happens is Th1 and Th17 are antagonistic. So as Th17 goes up and you start getting that inflammation, Th1 goes down. Mm-hmm. And when Th1 goes down, if you think about, wow, you can't fight virus infections. So then our chronic patients have, oh, they've got chronic EBV, right? And they have these HHV6 and they have these chronic infections, which can trigger pandas.
Right.
But then those infections go trigger the Th17, right? Then they trigger the immune system. And then that kind of leads to further Th17. And then we get the elevated Th2, because the opposite one Th2. So you can see how they get these cycles, the low Th1, low Treg cells, high Th17 and high Th2. And so then you have like our kids in autism, they've got autoimmune features. They got chronic infections that they can't fight. They're allergic and reactive to like foods and environmental things. So it's like their immune system is completely imbalanced.
Right. I always try to tell parents with my, PANS pandas, it might have started out from one infection, say it was pandas, right? From strep infection, but they tend to, a lot of them to move then into the PANS category where they're more susceptible to other infections like viruses or candida or mycoplasma and whatnot. So you tend to go into that realm. So that makes sense based off of what you're saying. But can you also explain how a leaky gut can lead to autoimmune disease? In different parts of the body, like such as the joints and rheumatoid arthritis?
Yeah, because I think that's really important to think about. So there's some good studies, especially on like, say, rheumatoid arthritis, where you have the inflammation in the gut, you get the elevated Th17, and it releases something called interleukin 17. And interleukin 17, because you've got that leaky gut, gets into the bloodstream and travels to the joints. And then the interleukin 17, then in the joints, it triggers the inflammation response, right? So then you get more of the cells and actually literally the physical damage.
Right.
There's also a study with the lungs where you think you actually breathe in pollution. I think of all our fires recently. And then you get a leaky lungs, just like you get a leaky gut. And the same thing, you get elevated Th17, releases interleukin 17, goes into the bloodstream. And you can get a leaky brain. Think about our PANS patients. Think about all the sinuses. The sinus can get the same thing.
Absolutely.
Right.
Absolutely. And then of course there's going to be flares in the symptoms that we see, right? So whether that's,
Right.
swelling in the joints or
Mhm.
pain or, neuropsychiatric symptoms in our kids. So what can we do to control the autoimmune flares by balancing the T helper cells?
Yeah. Well, as I said, we have this cycle, and this inflammation cycle. So if the Th1 and Th17 are antagonistic,
Mhm.
we really need to get the Th1 cells up,
Yes.
right? So you can fight the infection. Getting the Th1 cells right now, think about the COVID, is huge.
Right.
You really need that in terms of fighting infection.
Right.
And then you need to basically address the inflammation too, like naturally get the inflammation down. Um, And one thing I recommend, and I've learned a lot about, and I talk about it in the second part of the article, which is more treatment, is something called transfer factors.
Yes.
And transfer
Please tell us
factors,
about that.
right? Yeah,
Yeah.
transfer factors are released by T helper cells, and I didn't learn about that in medical school. I learned all about antibodies, but not about the transfer factors.
Right.
So I meant,
Right.
I don't know if you want me to just go into the.
Yeah, I mean, because I think it's important, like if you had any clinical pearls on how to increase the Th1 cells first to just
Right.
bring down the Th17, and then maybe we can go into, what transfer factors are and why they're important and how they impact our immune
And
system.
impact, right?
Yeah.
So I think about, so we know like B cells release antibodies. We know that those are proteins. They go mark a cell for destruction, right? So they're really markers. So T cells are released by T helper cells, transfer factors, I mean, and they're small little antibodies, just like the antibodies from plasma cells, B cells, and they go mark an infected cell for destruction by like natural killer cells or cytotoxic T cells.
Mm.
So again, they're kind of markers.
Right.
But they also, as I said, they increase natural killer cells, which are huge. Like your first line immunity for viruses are natural killer cells, right? So you need that for viruses. You also need that for cancer. It also increases Th1, which drives Th17 and Th2 down, which also increases the Treg cells. So it really helps balance that. And it also helps your body fight infections. So those infections aren't coming back to trigger Th17 again.
Right.
So you're really trying to break the cycle, if that makes sense.
Yes, for sure. Great. And then there is a product that I've used in practice called Transfer Factor Multiimmune. Do you use that, and how does it impact the immune system? Is there research that shows how it works?
Yeah, I use it all the time. It's my number one, like I have all my friends and family on it now with COVID.
Awesome.
Because you want that Th1 up, you want the natural killer cells up. And it has transfer factors in it. Also has some colostrum, zinc, and selenium, which are my big antiviral minerals. Right. Some of our mushrooms, astragalus, which is another one that increases Th1. So I like it too. And the other thing about it, there's research on it, which for me is huge.
Right.
Because I think in natural medicine, we really need to have research on what we're doing to really kind of say, hey, this works. We can show this works. This is really important. And I think this whole pandemic illustrates how much we need to do personally, from vitamin D levels to improving our immune system.
Absolutely.
So, yeah, one of the studies, sorry about my.
That's okay. Take your time.
I don't know. I'm not sick anyway. I took my multiimmune today. I did. I really did. I do have allergies though, so
yeah,
I guess I need to take a little more. But so we do have studies. So in terms of natural killer cell, and not natural killer cell numbers, like in autism, sometimes they have normal natural killer cell amount, but they don't work well.
Right.
So this improved function in 2 of the studies. Okay. Well, the other thing that the transfer factors do is they also increased, like, they kind of a recruitment, like, hey, we need more lymphocytes here. We need more T cells. So it's like bring in the troops, right? Because they're basically what they are. They're like messengers. But it also showed some immune modulation. So increase in interleukin 10, which is released by Treg cells. So kind of a more immune modulating. So really kind of immune balancing formula. So use it kind of on a chronic basis for a lot of the autoimmune balancing. It's also great if you have a cold or you're first sick. And this is my pearl, and everybody in my family knows this. You take 3 times a day. You hit it really hard, like every time my parents, who were my dad, especially who was high risk, they had to travel twice. And they're like, okay, we did the three times a day, or during that day, and then after, that was like, they're so proud of themselves.
Awesome.
So I do think it's kind of critical, especially now, and to know, it can really help you acutely, but also kind of a chronic balance. As I said, there's also some specific ones, some more targeted ones, which are also sometimes hard for people to say. I don't know if you want to go into that, because one of them is really good for PANS pandas because it covers a lot of different things.
Yeah, that'd be great. I know I use one often in practice, the transfer factor plasmique,
Yeah.
for my mycoplasma patients and Lyme patients. I've had great success with that because we know mycoplasma is a very stubborn germ. It takes a
Yes.
while to get out of the system. So I've had great success with that, but I'd love to hear, other ones that you use.
Yeah, and that's the one that's my primary one too that I use. They're different, three of them. And the way I think about them are more passive immunization. So basically you take the cow and you give inactivated versions of these, and then you collect the transfer factor. So their body has already reacted to it, right? And then we're taking that. So I think of the multi-immune, okay, kind of balance immune system, strengthen the immune system. And then the targeted ones, you're really like, oh my God, okay, we got mycoplasma. All right, we know what to do with it.
Yeah.
And the plasmic is mycoplasma. It's also candida. It has Borrelia in there. And then the EBV, the HHV6 is kind of like the chronic viral ones. So a lot of people use it, I said, for PANS pandas. And you can use it with the multi-immune because I figure they go together really well.
Right.
We also have
Sorry, can I just ask you a quick question? How do people tend to tolerate the multi-immune one with the different herbs in it? Do you see that it tends to be well tolerated?
I think it's well tolerated. Some people have to go slowly. There is a mushroom-free version, and there is a transfer factor sensitive, which is only transfer factors. And so when I started using them, I was like, oh, with all my kids' autism, like I always started with the sensitive ones. But it's really, I think, it's designed to, there's other kind of strengthening of the immune system. So I think the multi-immune is much stronger. If I have somebody's like, I think, oh, they might react to like pomegranate, or they're like reacting to phenols or something, I might do the sensitive, but I really try to do the multi-immune because I think it's a lot stronger.
Great.
So.
Great. And was that the other one, the sensitive one?
Oh no, there's an Enviro, transfer factor Enviro.
That's right. Yes.
Which targets mycotoxins. So a lot of people are using that with mold. And then there's an L+, which is like all the tick-borne diseases.
Awesome.
So Borrelia, Babesia, alveolus, Bartonella. So people use them together. You can have die-off with them. So like multi-immune people, you can usually, even with kids, start with 1, go to 3 pretty quickly. But the more targeted ones, you definitely need to start with 1. And sometimes every other day. I don't know if you found that also, that people can have die-off with it. So
yes.
Particularly they also have multiple infections, which is a lot of people do. So yeah, that one, and I said, some people, once they do that, they use this kind of like a maintenance, to try to keep them from kind of flaring up again.
And do you use multiple ones together depending on the complexity of the case, just because our patients tend to not be that easy? So they have a lot of stuff going on. So you can use multiple?
Yeah, I definitely do. I would never start them together just because of die-off again. Right. As I said, some people are really sensitive. I mean, I've done 1 every other day to start. And it's funny because some people like Enviro can take no problem. Then the plasmic, they're like knocked out with 1. Yeah. Or vice versa. So it's really, you have to kind of go slowly.
Right.
Taking the inflammation down. And I also think using the multi-immune first, you have less of a reaction, right? Because you've already strengthened your immune system. So that hopefully their immune system is kind of starting to work better anyway and starting to help fight those infections. Where if you just kind of go on with the targeted ones, I think sometimes you might have more die-off.
Yes. And then, so talking about autoimmune disease and how, that dysregulated immune system can increase inflammation, how can we also address this chronic inflammation that we're seeing in our patients while still kind of trying to balance the immune system at the same time?
Right. Well, I think of, we have some really great natural anti-inflammatory herbs. I said, I think your background probably taught you much better than mine. Traditional medicine is like, it's not all NSAIDs. Yeah, so I mean, think about our things like curcumin and boswellia and resveratrol, even like NAC or EGCG. And I think of, I said you probably learned a lot more of this about in terms of herbal medicine, but things are synergistic and using combinations of things. We do a product called Cytoquel that does have research in terms of pain and inflammation, taking both down. It has some of those like curcumin, resveratrol, NAC, has tocotrienols, which are basically part of the vitamin E family, but really kind of very strong antioxidants in EGCG. And I think that works. I like the Multiimmune and the Cytoquel together.
Mm-hmm.
And again, or even just saying COVID, right? The inflammation is what really is hurting people eventually.
Right.
And high risk people with chronic disease have higher inflammation. So their baseline inflammation is higher. So they're probably at more risk. That's probably contributing to their risk.
Right.
So yeah, so my parents, they're on Cytoquel, they're on Multiimmune. I'm like, what's your vitamin D level? Okay, you need to get that up. You're taking your vitamin C.
Where can people get these products that we're talking about? Because they're from Research Nutritionals.
They're from Research Nutritionals. I mean, any practitioner, licensed practitioner could get an account and carry them, or their patient directs. The patients just can get a code and order them. Or if, like my friends, they have me, because I send them them. And my kids are like, Mom, I need more of this. I'm like, all right, okay. But I do think just you have to, we don't even know how long all this stuff's going on. But then all our chronic patients, I worry about, our patients who are already, if you already have an imbalanced immune system, like why wouldn't our kids with autism, even though they're in theory children, should be lower risk, why would they not be higher risk?
Right.
If their body's already like battling EBV and mycoplasma.
Right. And how are you seeing your patients handling COVID? Have you had any?
Yeah, I haven't, I see patients in Colorado, and Colorado had a really horrendous flu season, but early.
Mm-hmm.
So my daughter works at a ski resort, and that's where it came in to Colorado. So they're like tested everybody at where she worked. And so I think a lot of my patients had it and just had the flu.
Mm-hmm.
And, as I said, I always recommend if somebody's acutely ill to the Multiimmune and,
Right.
the typical, make sure you have zinc and all that.
Right.
And so I didn't have any worse problems than I usually do.
Mm-hmm.
But again, we didn't even know at that point.
Right.
And then everybody's locked down, and so they didn't.
Right. Yeah, that's what we were seeing in practice too, that supporting them with like the basic antioxidants and, the immune supporting herbs that, they were getting through it, not
Right.
wood.
Yeah.
But yeah, so I'm glad you're having the same experience out there in Colorado as well.
Yeah.
So,
I didn't think it was any worse than kind of any other flu season,
Right. Right. So any final thoughts or that you have regarding this topic to share with the CNPA community?
Well, I think, as I said, if you kind of, when you kind of look at it first, oh my God, T numbers and interleukin here and that, and it's kind of little transfer factors, and people looking like, oh my God, immunology again. But I think if you just kind of break it down to those 4 T helper cells and some basic ideas that you try to get in balance and take the inflammation, you can really balance inflammation, autoimmune, and like fight infections. It seems to me, once you think about it that way, it makes a lot of sense. And then you can really help your patients. Okay, this is our goal. These are our goals. This is how we can do it. Because we've got to get some kind of balance for them to kind of, break the cycle. So otherwise they just kind of keep getting more and more inflamed.
Absolutely. Well, thank you for this very valuable, incredible information. I know I've learned quite a lot that I'll be able to implement into practice. And I'm sure a lot of the CNPA members feel the same. So I just am encouraging everyone this was just like, an introduction to the information that you had in the Townsend letter. But the part 1 was really great about the mechanism of action and even, reviewing some of that immunology, I think, of how to describe what's going on to the patients, I think is very helpful rather than just saying, and we all kind of get into kind of using these like blanket terms like inflammation or autoimmune disease. So I found that to be a valuable resource to dig a little bit deeper, but be able to present it in a way that, was knowledgeable and, people were able to relate to. And again, I loved the graphics in there in the table.
Oh, good.
So that was helpful. And then also the part 2 for treatment also very helpful. So thank you for that information. And we're going to send it out to the CNPA community. And I also wanted to give a shout out to Research Nutritionals for being such a great resource for these products, but also to be such a great sponsor and support for the CNPA members. So thank you so much. And I hope we can do this again, because you have a lot of other work out there about certain things like glyphosate and all of that. So I would love to again if you would be open to it.
No, definitely. I mean, as I said, I feel like I've seen patients for a long time, but I also feel like an educator, and the more practitioners know, the more patients we can help.
Absolutely.
And I like to make it so, like, does this make sense? If it makes sense, you can explain to patients, you can know how to target things. So I'm glad I could be helpful and contribute. And yes, I'd love to do this again. That would be great.
All right. Thank you so much, Dr. Hamilton. And we'll talk soon.
Okay. Sounds good.
Okay.
Okay.
Bye.
Bye-bye.